to provide me this technology. Mm, ಅದನ್ನ ಬೆಳಕು ಬಿಡ್ಬೇಕು ಅಂತ ನಾನು ಹೇಳ್ತಾ ಇದ್ದೀನಿ. So earlier to begin with, earlier it said to be the less prevailing disease. But now since 2 5 years, the disease incidence is increased. 156 to 290 people per thousand population. But it varies geographically. Still, it is less in India, 44.3 per thousand population, but very high in Karnataka. So this is very devastating statistics we get. Very high in Karnataka, that is 19.46, almost 20%. So there are many causes for it. And this ulcerative colitis incidence I have taken. I have not taken the incidence of Raktatisara. So there is no specific treatment for this in according to modern, but we have a definite treatment. So let us discuss on this. So I am not going to read shloka, don't worry. Because I am an academician, I have kept those as a reference, and whatever I practice, so I do practice with the reference, and that only teaching outcome only I implement in the treating the patients. So Grahani, Pittaj Atisara, Bhayaja Atisara, Shokaja Atisara. So these are all going to contribute to this Raktatisara. Okay. So it is rather a condition. It is not a disease independently. It is one of, it is being told, or what I understood as, it is one of the condition which is going to be aggravated in these conditions, like Grahani, Pitta Jatisara, Shoka Jatisara, Bhaya Jatisara. So when it is going to, already the situation or condition is uh, existing, and this is going to adverse, or this is going to, ಇದ್ರ ಚಾರ್ಜರ್ ಬೇರೆ ಐತಿ ಹುಚ್ಚ ಏನೇನು ಮಾಡಿ, you take charger from there, and it is the grahani, when upeksha is done, it is going to an increase. When pittajatisara is upeksha of pittajatisara, then it leads to raktatisara. Shokajatisara, bhayajatisara, when it is not treated properly, then it is going to lead to raktatisara. And raktatisara, and that would be very difficult to manage. So why it is difficult, that we shall discuss in the management. And some associated pathologies we need to understand when we treat this disease: Samapitta, Vishamagni, and Grahani. Grahani Roga, in same, these Vishamagni and Samapitta will be there. Some are not having Samapitta, but Vishamagni is very common. But treating the Vishamagni is a very difficult task in Grahani and in Raktatisara. So why it is, then we'll discuss in the treatment. And Lakshanas. So Charaka, Shushrutas, Shula will be there. Shula as a Lakshana. Shula is not as a Vadi. Shula as a Lakshana is a major predominant or pathognomic sign. Soon after taking the food, they get the pain abdomen and get the urge of defecation. And scanty urine, because of less absorption of water, almost stool is watery and mucoid stool, and water is not absorbed. There is scanty urine, thick urine, or concentrated urine, or urine is having smell. Then antrakujana. So this antrakujana is there in grahani also. Ghatayantra grahani, we say there is sound, peculiar sound. Ghatayantra grahani, vataja grahani lakshanas. So here also there is a sound and associated with the pain. Pain in waist, thighs, and legs. So this is another thing. Pain in the waist, that is the pelvic area, and thighs and legs. This is because of weakness. Food is not digested, or improperly digested food is defecated as it is, and person will suffer from the nutrition and dhatu kshaya. Dhatu poshana is not carried out. When there is no dhatu poshana, and person becomes emaciated, and frequent stool with flatus, scanty, frothy, dry and brown colored stool. See, sometimes brown colored or red colored stool. Sometimes maybe brown, or some that blood mixed stool, we can say. And colored stool, mucoid stool. Initially, it will be mucoid stool. When there is a mucoid stool, if the person does not take treatment, definitely it is going to lead to Raktatisara, that is blood mixed stools. Then Trishna. Trishna, yes, of course, Trishna, whatever food when it is not absorbed, large intestine when it is affected, Pakwashaya when it is affected, there is, according to Ayurveda, the water absorption takes place in Pakwashaya. Mutra Utpatti takes place in Pakwashaya. And from Pakwashaya through Gavini, it comes to the Basti, and from there, the Mutra Nishkashana will be there. So when there is no mutra formation, or less mutra formation, there is water is absorbed very less, because water is not digested. One thing. Another thing is, the digested food is not going to stay in the large intestine. There is no question of absorption of adequate quantity of water in the large pakwashaya. So trishna, it leads to trishna. And Vidahi and Gudapaka. Vidahi lakshanas will be there. Sometimes digestion, sometimes indigestion. And food, whatever is consumed, it is indigested, and as it is told in Grahani, Puti Murbaddam Murdravam. So sometimes constipation, sometimes loose stools. And whenever there is a loose stools, there is a foul smell. And Gudapaka. Repeated this Atisara causes Gudapaka. Repeated Atisara causes Arsha. So, like this Gudapaka will be there. And then Upadravas. These are all the Upadravas, Shwasa, and Kshinata, Jwara, and Hikka, Shwasa, Trishna, Jwara, Shula, and Murcha. Murcha also, and unconsciousness. Literally, I have seen the patient becoming unconscious by passing repeated stools, lack of this nutrition, lack of water, lack of electrolytes, everything. Okay. So now let us consider, understand the samprapti of this Raktatisa. I think this flow chart will give you the entire idea of this samprapti. So aharaja, viharaja. So pitta prakopahara, katu amla lavana. So very clearly it is mentioned katu amla lavana. Spicy food, amla rasas, alcohol, consumption of alcohol along with the spicy, what you say, sides ಏನು ತಗೋತಿರಲ್ಲ ಅದು ಕಟು ರಸ. And these spicy, this chana or shenga chips, or chaats, or this non-veg chaats, so they are all very spicy. And along with that, alcohol when it is consumed, and more consumption of lavana. Earlier, it is said to be this ulcerative colitis is common in those who consume this beef, but that is not the case. I have seen, or so far, what cases I got, they are non-beef consumers or non-pork consumers. So that is not the truth. So here, bakery items, less fiber diet, or these are all going to contribute. And then adhyashana, anashana. Adhyashana, the food which you consumed, it's not digested, and again I am going to consume. And it is going to alter the digestion. Then anashana, doing fasting and suddenly take the heavy diet. So whenever you are fasting, you should gradually shift to the normal diet. Do not shift immediately to the heavy diet. So that you must keep in mind. And Ratri Jagarana. See, Ratri Jagarana is another how much exercise is required to digest the consumed food. Sleep is equally required to digest lifestyle disease also. So how it is lifestyle disease? We must remember Ayvalli sir here. Okay. Brahmi muhurte uttiste jirna jirna nirupayan. So we tell Brahmi muhurte uttiste only that much we tell. But next version what he has told jirna jirna nirupayan. The food which is consumed previous night, whether it should be defined whether it is digested or not digested. If it is digested, you wake up. If it is not digested, don't wake up. So this is the principle behind wake up. So you must consume less food. And if you have done Ratri Jagarana, so you must have a sufficient sleep to digest the food. So these are all going to aggravate the Pitta dosha. And when Pitta dosha causes Agni Mandya, so here Vishamagni comes. Here Agni Mandya is Vishamagni here. And then Ama formation and Samapitta, Samavnavrita Apana. And sometimes this Amashaya Gatavata. Amashaya Gatavata not mentioned here. Amashaya Gatavata will also cause Agni Mandya and then leads to the Ama formation. And then they take Ashraya in Pakwashaya, then it leads to the when food is not digested, then it leads to the loose stools. Atisar. And loose stools, the other independent contributors are Nidanartakara rogas. त्रयरोगः प्रायः त्रयरोगः प्रायः परस्परहेतवः अर्शांसि अतिसारश्च ग्रहणिदोष एव च. So Arsha, Grahani and Atisara are one among the Nidanartakara rogas. So we are dealing with Atisara here. So Arshas and Grahani. Grahani is a topmost cause for all these diseases. And Arshas, how it is going to cause? So whenever there is Arshas, Anuloma DS, Anuloma we give. So long-standing use of this laxatives. So laxatives should not be the line of treatment. We have to treat the Agni in Arshas. Then normalize the Vibandha. But giving the laxatives is not the principle. So when you I am taking Kayam Churna, I took all medicines but not help. I am taking this Kayam Churna. So Kayam Churna ತೊಗೊಂಡು ಅದು Kayam ಹೋಗು ಅಂತ ಹೇಳಿ. So without that they don't get defecation. So these long-standing use of these laxatives is also one of the causing factor. Then bhaya, stress. It's a psych factor, how you receive, how you accept the stress in your life. Stress, examination stress in students. Okay. And parents do give pressurize these students, their children. And then upeksha of pitta jatisar. Pitta Tisara, when it is treatment is not taken, ಇವತ್ತಾಗುತ್ತೆ ನಾಳೆ ಕಡಿಮೆ ಆಗುತ್ತೆ ಬಿಡು ತಾನ ಕಡಿಮೆ ಆಗುತ್ತೆ. So they neglect, and that leads to blood stained stools. And this is how this uh, disease manifestation of Raktatisara. And Chikisa Sutra. I'm not going to read these Chikisa Sutras. Just for reference purpose, I have kept. So what I do, how I diagnose, I tell you. So first and foremost is we have to do the Amapacham. We have to do Amapachana. Do not use Chitraka. Do not use Panchakola. Do not use Agnitundi Vati as you do, as I did previously. So here only one Amapachaka Dravya helpful here in Raktatisara is Soothsakarasa. If you use Chitraka, Tikshnan, if you use Panchakola, Katu Tiktarasas, Katu Tikshna, Katu and Tikshna, Tikshna, uh, draves. And if you use shunti, that is also katu and tikshna. So all going to aggravate the
Not hearing properly.
Sir, sorry to disturb you in between.
Not hearing, sir.
There's a voice.
So much disturbance, sir.
basma, it does pitta shamana.
Excuse me, sir.
That is why
Sir,
use
Samudri, sir.
Sudhasekara. How it is?
There's some there's some network glitch from your side, sir. We
Yes,
are
madam.
unable to hear.
Ah, yes.
We, we are unable to hear you, sir. Right from why
Note
you
kariye.
chose Sudha Shekhar.
Yes. Now is it?
Now it's
Now am
audible,
I
sir.
audible?
Now audible, sir.
Okay. Ah, yes. Why Sudhasekara? I tell you, uh, it contains Shuddha Dattura and Raupya Basma. Dattura does the Amapachana without altering the Pitta dosha. And Raupya Basma, it ಏನಾಗ್ತದೆ ರೌಪ್ಯ ಭಸ್ಮ
Not hearing, sir. Sorry. We are not hearing, sir.
does the pitta shaman. That is why Sudhashekar Rasa is given. Okay? Yes.
Sir, sorry to disturb you again. Can you come to the area where there is proper network?
Yes, yes.
It's again
No, no,
there's
no
a
issues. I am sitting.
maybe there's some issues. I mean, there's a break in the voice.
But I'm sitting to the window.
But still not audible, sir. I mean, there's a break, sir. Actually, your voice is breaking. Sometimes it's heard, but sometimes it's not heard
Just
properly, sir.
beside.
In front. Now clear, sir.
Madam, now am I audible now?
Yeah, sir.
Now clear, sir. Now okay, sir.
Dr. Sabir?
Yes,
Now
sir.
clear.
Yes, sir.
Okay.
Yes, sir. Yes, sir.
Okay. Yes. Amapachana, Shuddha Dattura and Rope Basma because of these two ingredients, Sudshekara, so that there is no Pitta Prakopa. Okay. Yes. And see, management of Avarana. So here
Sir,
we need
sir,
to understand,
sir, could you please share
we
the
need to,
screen, sir?
no, it is shared. Stop sharing, my dear. No.
Yes, sir.
Yes, okay.
Thank you, sir. Thank you, sir.
So, so when it is management, first is amupachana, then management of avarana. So amala pitta is avaranajanya. Grahani is also avaranajanya. And this initially, as I told, it is a condition rather than independent disease. So associated pathology is also I told avarana. Okay. Associated pathology is also I told avarana. So here avarana, what kind of avarana you come across? The treatment of amla pitta is purvam tu vamanam karya paschat mrudu virechanam. Okay, that is there. And in Grahani also, we have to carry out Sadhyavamana. Charaka has given a very good clue in management of Avarana. This is Amashaya Gatavata will be there. So Amashaya Gatavata, we have to carry out. So whenever in Amla Pitta or in Grahani, they do not respond to the treatment. Whenever you use Lavana Bhaskara, Avipattikara Churna, or whatever medicines you use, they do not respond. Their tongue will be thickly coated. Their tongue will be thickly coated and they do not respond for the disease. So that time you have to carry out Vamana. So if classical Vamana is not possible, but in case of Grahani, in case of Raktatisara, instead of going for Snehapana, directly go for Sadhyavamana. There is no need of Snehapana here. As soon as patient comes, morning patient comes, evening you can do. If evening comes, morning you can do. Do just Sarvanga Abhyanga, Bhaspasveda, and do not use here this Vamaka. Just Vamanopaka is sufficient. Vamaka, if you use, you'll end up with a problem. Don't use Pramati Dravyas. Don't use Tikshna Dravyas here. Just Lavana Jala. If Kafaja Lakshanas are more, use Lavana Jala. If there is associate, only Pittaja Lakshanas are there, don't use Lavana. Use Yashti Madhufant to do the Sadhyavamana. So immediately after Sadhyavamana, it releases Avarana and also to some extent Amapachana, and patient will have
Sir, not audible, sir.
a sound sleep immediately after Vaman. Sleep is so sound, they am I audible now?
So actually, there was a glitch again, sir. So now it's audible.
Uh-huh.
There's like a
Audible.
break in between, sir.
Yes, yes. Yes, yes. Now it is clear. No, no problem.
Yes, sir. Yes, now it's clear, sir.
Yes. Lavana Jala, if Lavana Jala, when not passing blood, previously passed blood and now blood is stopped, use Lavana Jala. Active bleeding and more Pittaja Lakshanas, Amla Pitta Lakshanas, then don't use Lavana Jala. It causes severe pain abdomen during and after the Vamana. And use Yashti Madhu fat. In such conditions, use Yashti Madhu Fanta. Akhanta Purna Yashti Madhu Fanta, 3 or 4 Vegas sufficient. So Sadhyavamana with Lavana Jala or Yashti Madhu Fanta. Why Lavana Jala? Why Yashti Madhu Fanta? I have made it very clear. And from where this reference is taken? It is taken from Grahani and Amla Pitta. Okay. And after this, to give 1 day gap, can you ask the other participant to mute their mobile?
Yes, sir. I have muted, sir.
Okay. And next is Basti Chikitsa. So they have been mentioned Picha Basti. Sharangdara has mentioned Picha Basti. Charaka has mentioned Picha Basti. Picha Basti, they call it as rather Pichila Basti. So we take the Kota and in that Shalmali Niryasa is added and then Basti is given. But to get Shalmali Niryasa is very difficult. Good, pure quality Shalmali Niryasa is very difficult. And yourself can prepare And the results with Shalmali, this Picha Basti, I am sometimes I got and sometimes I did not got. And Rakta Basti, as in Rakta Dhatu Kshaya is there, Raktam Raktena, Mamsam Mamsena, so that we have derived it from Ruddhi Samanai Sarvesham Vipiritai Viparya. Just it is a Santarpana Chikitsa, Lakshanika Chikitsa, it is not the complete treatment. When blood is less, you are giving blood, that's all, but it is not going to treat the disease. Then Anukta Basti, what I found results with this are, so Yashtimadu, Indrayava, uh, Indrayava is the seeds of Kutaja. So Yashtimadu Kashaya we prepare. Indrayava Kalka, 10 grams Indrayava is taken and Kalka is prepared. Mahatiktaka Krita and Madhu, because less Madhu, 30 ml only Madhu is added, because we do not want Lekhana here, but we cannot break the rules of Basti, so reduce the Lekhana Dravyas. So this combination, and every day same Basti, every day same basti. Initially patient may have 1 or 2 day little pain abdomen, and the stools are increased for 3 days or 4 days, or as long as basti is going on, stools are not formed. Stools are not formed. Some they start forming the stool third day. Some a long standing steroid dependent, they take more time. Okay, so uh, this basti you give for 8 days, and then shamanaushadis. Samapita lakshana Sutta Shekarasa. So when tongue coating is clear after basti, what doshas remained, that you have to assess and give the treatment. Kuta Jaganavati, keep it common. Kuta Jaganavati is absolute need in all type of atisaras. And Pittaja Lakshanas, give Kamaduga with Moktika. Don't give Kamaduga Sada. Okay, give with Moktika only, Pitta Shaman. So tongue coating is there, then Sama Pitta Sutshakaras. Tongue is very clear, then use Kamaduga with Moktika and Kutajaganavati. These three medicines are sufficient. And in case patient is stress oriented, young always come with stress. So you have to do counseling. Already there is a diagnosis, they do colonoscopy, histopathological study, and they reveal that there is no specific disease. You have to learn to live with this disease and take the steroids as long as you are alive. Or sometimes anti-tubercular drugs are given. Sometimes patients do come with the hepatotoxicity, sometimes with ototoxicity, sometimes with jaundice. So all these, when you withdraw those medicines, then naturally those things come down. Counseling, you have to say that yes, that is the treatment in that system, but here you have a definite treatment. You please try to follow the diet and then take the medicines for long duration. See, when they can take the steroids lifelong, what is wrong in taking our medicines for 4 years, 5 years? Sometimes 1 year, 2 year, they come out of the disease. So when stress oriented, when they are not having the cause for the stress is relieved, then naturally they come out of the disease. And medicines what you can use to relieve the stress or the thoughts is Sarpagandhavati or Brahmivati. I found Sarpagandha is the best one. You can give at the night, or whenever they are stressed, they can take Sarpagandhavati SOS. ನಂಗೆ ಹೆದರಿಕೆ ಬಂತು, ಭಯ ಭಯ ಆಯಿತು, ಏನು ಮಾಡಲಿ ಒಂದು ಸರ್ಪಗಂಧ ಒಟ್ಟಿ ತೊಗೊಂಡು ಸುಮ್ಮನೆ ಕೊಡು, ಸೊ ದಟ್ ವಿಲ್ ರೆಡ್ಯೂಸ್. And yoga, it is very essential to teach yoga. If you are practicing yoga, you teach the patients to do Jalandhara Bandha, Udyana Bandha, and Moola Bandha. All three together. Moola Bandha is absolute need, because the patients, I have not told in Lakshanas, but patients will have incontinency of stool. When the urge comes, they are not able to hold. Their sphincter capacity is lost because of repeated defecation. recurrent defecation. So you ask them to practice Mula Bandha. Mula Bandha will not only give strength, it will give the capacity to the sphincter to hold the stool. So that is also equally required along with the treatment. And steroids. Steroids are not the solution. Please try to understand. Please try to understand steroids. And withdraw the steroids in a tapering dose. And before withdrawing the steroids and the immunosuppressants like methotrexate, already patients will be taking those drugs. When you stop or when you withdraw steroids, disease increase. And patients do not come immediately after taking the steroids. Patients will be taking steroids for 3 years, 4 years. Already they develop Cushing syndrome, or 6 months, 1 year they take, and they realize these complications of steroids, and then they approach Ayurvedic practitioner. So that time already they develop some complications of adverse effects of steroids. So that time you have to tell them that when I withdraw the steroids, your disease is going to increase. You have to sustain. You have to sustain. And gradually, the effect of steroids, the 6 month, 1 year steroids, the effect of steroids will be for 2 years, 3 years. Then it comes down. So it is not so easy to withdraw the steroids also. So, but you have to withdraw and ask the patient to sustain. And to conclude, dosha vikalpa helps to diagnose the disease, and correction of vishamagni. As I told, correction of yes, dosha vikalpa. So when you started, there was a samapitta. You did shodhana, and you completed shodhana, and end of shodhana there is no samapitta, it is only pitta. So there you have to do the dosha vikalpa. So gunatah ruddhi, karmatah kshaya, gunatah kshaya, what vikriti amsham cha kalpana we have studied, that's going to help for dosha vikalpa. That you come to a exact diagnosis of a disease and the condition and what procedure you need to do. And correction of vishamagni. See, as I told, correction of vishamagni is difficult in Raktatisara. If you give amapachana, pitta prakopa and bleeding increases. If you do amapachana with katu and tikshna dravyas, if you do amapachana with datura and raupya basma, it is not going to happen. So in my experience, correction of vishamagni is absolute need, and this vishamagni along with the medication, it is sometimes avarnajanya, amashaya gatavata. So that time you need to have Satyavamana. And if it is, I told at the beginning, if it is uh, Apanavruta Samana, there also Vishamagni will be there and Shula will be there. So that time you can add Shankavati to reduce the Shula. Shankavati or Mahashankavati. So here, in such condition, you have to give along with the diet. Along with diet. Madhya Bhukta. Madhya Bhukta will relieve in 10 minutes, pain abdomen will be relieved. No need of using antispasmodic. Shankavati or Mahashankavati ಡ್ಯೂರಿಂಗ್ ಫುಡ್ ಒಂದು 2-3 ತುತ್ತು ತಿನ್ನಬೇಕು, ಗುಳಿಗೆ ನುಂಗಬೇಕು, ಮತ್ತು ಊಟ ಮಾಡಬೇಕು. ಸೊ ದಟ್ ಈಸ್ ಗೋಯಿಂಗ್ ಟು ಹೆಲ್ಪ್ ದಿಸ್ Samanavrita Apana. And then Amapachana, as I already discussed it. And diagnosis and management avarana is equally important. And if you are not able to diagnose avarana clinically, you are not able to successfully adopt the uh, appropriate procedure, shodhana procedure. Then treatment shamanaushadis, sadhyavamana. Sadhyavamana may not be every time. So this basti treatment, basti anukta basti, what I told. So this basti you have to repeat 3 months, once in a 3 months, and after that 6 months, once in 6 months. Let them come and get admitted and take the basti. Okay. Do not give basti in OPD base. Or even if you give basti in OPD base, do not send the patient home before basti pratyagamana. If basti pratyagamana is not there, I hope you too also have clinical experience, and I tell it basti andar to jaan bahar. Okay. And what message you can take home? Do not play with the life of a person by liberalization with steroid prescription. Young chaps, 18 years, 20 years, 25 years, your own students, they come. Don't give them steroids. Don't prescribe steroids. And whenever they go to super specialist and they say liberalization in prescription of steroids, and they give the steroids for long standing, and they develop Cushing syndrome, they develop adrenaline insufficiency, they develop diabetes, complications of diabetes, skin problems, and they develop fungal infections, and totally their health becomes upset, and recurrent viral infections, recurrent consequences of steroids. I am not at all in favor of steroids. Steroids, no medicines in ICU is helpful. That time use steroids. Otherwise, do not use for a medical disease. Do not use steroids. Joint pains, don't use steroids. Low back pain, don't use steroids. Skin problems, don't use steroids. We have a remedies. And with this, I would like to thank the Millennium Batch, Dr. Viresh, Dr. Praveen, Dr. Savitri, Dr. Krishna Nayak, and all others for giving me opportunity to share my views. Hope I clarified, and if you have doubts, you can ask me questions. I will
Thank you,
stop
sir.
sharing the
Thank you.
screen.
Yes, sir.
I will
Yes, sir.